Good evening, all. I welcome you all to another session of A to Z of Nephrology by Dr. L Mahadevan, sir. Dream, dream, dream. Dreams transform into thoughts, and thoughts result in action. These are the wonderful quotes given by Dr. APJ Abdul Kalam, and we remember him, the great human and the scientist of this century. According to this quote, I think Mahadevan sir would have dreamt of learning Ayurveda. He breathes Ayurveda, and he also in his dream he would have dreamt about Ayurveda, and he would have dreamt that Ayurveda should reach each and every student who is going to learn Ayurveda, and he teaches us in a very easy and understandable way. And he would have also been dreamt to be a wonderful teacher, guide, mentor to the Ayurveda community, and also to be a great human being with lots of virtues, where I search for words each and every time I think about Sir. I welcome Sir to start the insightful session about A to Z of nephrology. Over to you, Sir.
Thank you, Amma. Thank you very much for the very kind words and beautiful introduction. Thank you. Good evening. And we started with the anatomy of kidneys, bladder, urethra, and ureters. Vasti is one of the Sadyapranagara Marma. We talked about many issues, and we have a lot more to learn. Issues of prostate, erectile dysfunction, urethritis, cystitis, infections, pyelonephritis, tuberculosis of kidneys, bladder, prostate, and various types of cancers that occur in the genitourinary tract, and other issues, very complicated issues like electrolyte imbalance, metabolic acidosis, metabolic alkalosis, hyponatremia, hyperkalemias, and yogas, Mutra Sangrahaniya Ganam, Mutra Virajaniya Ganam, Mutra Virajaniya Ganam, Shilajat Rasayanam, how to do Shilajat Rasayanam in a practical way. 1 tula, 4 kilos is not possible nowadays. Then we have to talk about diabetic kidney disease, hypertensive kidney disease, microalbuminuria, renal osteodystrophy, hyperuricemia, uric acid elevations, complications, and the diet. Diet itself is a 1.5 hour talk, because we should know, because all these apple, tomatoes, beetroot, carrots, cabbage, they are all new age vegetables. And we should know the Rasaguna Virya Vibhagam of these things without samskara and with samskara. And potato is Madhura Rasa Snigdha Guna, and you say it is gas. Unsakkadangi is told in their Siddhar Padal, Siddhar compositions. Like we have sutras, they have Padal, Vendbas and other things. He told me, Tattai Payarigal Mochai, Tagayara, Varakal Kandu, Kotai Urlakirangil, Kodiyador, Vaivudondrum, Totu Parkade Endrum, Suikaga Noiberade. I told this potato came after 16th century. This would have been Idaicherigal. Somebody would have added this in the middle. So prostate is a very important organ. I told you, one fellow from Arunachal Pradesh wrote to me, Guruji, I was highly impressed by your class. Kindly accept my salutations and prostrate to you. I wrote back, I accept your salutations. Prostrate, you keep it with you, you may need it. So we had a case of burning micturition at the end and burning sensation after sexual life. There is a perianal burning also. We were evaluating. First Pitta Samana medicines were given, Pitta Vriddhi in Apanasthana. We gave that, and there was no response. Then we went for urine culture, GTT, urine PCR, cystoscope, intravenous spyelogram. We couldn't find anything. ESR was always borderline elevated. So what I did a Monto and a gold standard TB Ferron, and it was positive, strong positive. So we did, with the help of urologist, we did the biopsy of the prostate, and it was prostate, tuberculosis of prostate. People appreciated us for that diagnosis. So very rarely we think about these issues, and many things we miss. What we do not see in the curriculum, you miss. A discoid lupus erythematosus producing lupus nephritis, you miss. IgA nephropathy, you miss, because you have not seen in the college. Professors could not identify, so you miss. So what we miss is more important than what we diagnose. What is not possible to cure is more important to us than what is curable. There were some doctors who were fanatics about Ayurveda. I was also invited to the Sadas. Some 10 Vaidyas were sitting. So they discussed and diagnosed the case as Kadigraham. What a great diagnosis. Can you diagnose? Kadigraham. Kadigraham is the translation of Idupuvali. Then another fellow told it is not Kadigraham, it is Prishtagraham. Then another fellow quarreled, it is Trigasholam. I was completely keeping quiet. Then my turn came, I told you, okay, this is Kadigraha. Have you read Gadanigraha? The Pakvase Gadavadam, Kugundra Marmavigadam, all these discussions went on. I told Vada Pradanya Kadigraham is spondylosis, where Madhurarasam Kadigrahanasanam Dhanvantaram is given. Pitta Pradanya Kadigraham is ankylosing spondylitis, where Amrudottaram Navakarshikam is given. Kapha Pradanya Kadigraham is disc bulge, where Varunadi Sakajaradi is given. So prostate is a very, very small gland, and the ultrasound, it should be less than 28 cc. And the residual urine should be less than 40 cc. So more residual urine, prostate enlargement happen in a particular age. Like menopause, men also have andropause. Menopause is O-men pass, P-A-U-S-E. Men, you stop there. That is menopause. This is andropause. So prostate enlargement happens in almost all the men. Very few people, they have enlargement, they don't have symptoms. Changes in the cells of the testicles play a major role. People who have done orchidectomy, that is testicles removed, do not develop BPH. That is why in prostate CA, they remove the testicles. There is dribbling of urine, urinary retention, incomplete emptying of the bladder, incontinence, and urge to urinate more than 2 times. Pain during urination, slow or delayed start of urination, strong urge to urinate, and weak. Digital rectal exam, urine flow, post-vital urine in ultrasound, pressure flow studies are commonly done. But for an Ayurvedic practice, USG, abdomen and pelvis, or whole abdomen with residual urine. After passing the urine, they should go with full bladder. After passing the urine, you should take the residual urine and you should ask them to double void. After double voiding till the urine is present, then it is significant. Likewise, bladder wall thickness is 4 mm. More than that, it's cystitis. A lot of cystitis are there, radiation cystitis and all. Next. Urine analysis. I will teach you how to analyze urine report. Then urine culture, morning first urine, midstream urine, which is called clean catch method, PSA, prostate specific antigen cystoscopy, and urea and creatinine. Now they have reduced the value of creatinine in women. It is up to 0.9 only. When it can be up to 1.2, but when it comes 1, already 40% of neurons would have lost. Next. So uroflowmetry, how the speed of the urine is understood. Detrus or weakness, all are understood by uroflowmetry. Very simple test. Even we can have it in our hospitals if you have a technician. Urine flow declines with age. Next. Residual urine should be checked. So, prostrate, ashtila, pratyashtila, like that you can tell. Or kapha vriddhi in apanasthana with apravritti lakshana, you can tell. So, kapham is shidam, apana vayu is shidam. So, medicine should not be shidam, medicine should be ushnam, kaphavadagaram, anulomanam. The kaphavadagaram is very important because vada you have maduramla lavanam, pitta tikta kashayam, maduram kafam kadu tikta kashayam, vada pittam maduram pitta kafam kashaya tiktam, and vada kafam there is no rasa, only virya is available. That is why kasturi gudiga, gorojanadi gudiga, swasanandam, pippalyasavam, Kanagasavam, Dasamula Rasayanam, Gomutra Haridagi, all are given in Tamakasvasa. And my dear students, you should differentiate Vada Pittam from Pitta Vadam, Pitta Kafam from Kapha Pittam. Vada Pittam is vertigo, Pitta Vadam is gastritis. Pitta Kafam is herpes zoster, Kapha Pittam is eczema. Vada Kafam is bronchial. Vada Kafam is left ventricular hypertrophy or infarction, stroke or cardiomyopathy, and Kapha Vadam is bronchial asthma. So in Vada Pittam you give Vidaryadi, in Pitta Vadam you give Drakshadi, in Pitta Kafam you give Guduchyadi, in Kapha Pittam you give Arakvadadi, in Vada Kafam you give Ashtavargam, in Kapha Vadam you will give Yelakanadi. So this is the protocol Amsamsha Kalpana. So Vastigata Gulma Chikisa. In Gulmam, Kurvandi Panchavidaha Gulmaha. So the Gulmam, you have got an umbilical area, epigastric area, hypochondric area, and the two parshvas, you have right iliac, right lumbar, and right hypochondrium. So all these 9 segments comes under Gulma. Beautiful anatomical surface anatomy. The surface anatomy is beautifully told in Gulma. So Gulma Hara Ushadas upon Anulomanam. Yesterday we started about Anulomanam. Many people think Anulomanam is downward movement of Vayu. That comes in the Virejana context. The mode of existence of Vayu in physiological limits with its Prakrita Gadi is called Anulomana. That is equal to Tamushwasa, Nishwasa, Utsaga, Praspandana, Indriya Padava, Vega Pravartana Divigi is equal to Anulomana. Mushwasa is Praspandanam, parasympathetic pumping of the heart, vagal, Indriya Padavam, sensory perception, cortex, subcortex, Vega Pravartanam. So all these cortical, subcortical and stem is told as the karma of Vayu. They didn't talk about other things. It is central. It is central. And Kaphavadakara Ushadas, avoid Mutrala Ushadas because Goksharam is Shidam, Bala is Shidam, Sadavari is Shidam, coconut water is Shidam, Ikshurasam is Shidam, barley, and all these things are Shidam. They are Mutra. Kshayam we will be giving. So Sadavari, Goksharam do not have any role in prostrate. So Avabidaka Snegam, Avagaka Svedam, Virechanam. Mudavada Anulomanam. Mudavada Anulomanam is a word told in two places. One is in Tali Sabatradi Churnam, another one is in Dadimadi Kridam. Mudavada Anulomanam. Dukkha Prasavininam cha Bantyanam cha Prasasyade. We call her Dukkha Prasavani. How do we know Dukkha Prasavani? Dukkha Prasavani, already she delivered 8 years before. Then she became pregnant after 8 years. So first pregnancy was painful. So we give Dadimadi. In primary infertility, we give Kalyanagam and Palasarpis. So Virejanam with Misragasnegam. In my knowledge, Misragasnegam is best. And Anuvasanavasti with Pippalyadi Thailam and Ingavajadi Kalkam is highly useful in BPH. Next. Varunadi Kashayam, Saptasarang Kashayam, Pippali Saindavam, Hingu, Gridam as Prakshebam, Sukumara Kashayam, Chitraka Grandyadi, Ashtanga Gradayam, Gulma Chigissa, Hingu, Vidalavanam, Saindavalavanam, Veeradaradi, Vidattal, Kashayam, Hingavachadi Churnam, Vaishwanara Churnam, Shardula Churnam, Naracha Churnam. Shardulam contains Kumbam and Nigumbam. Shardulam is a purgative, very big purgative. It is not available in market. Ugram is Vacha. Hingavachadi, modified form. Hingavachadi with laxative property. Narajam is simple yoga. Saindavam, Haridagi, Kanam, Deepyagam. Simple yoga. Sardulam is a big yoga. Next. Sardulam, Kadurasam, Vushnaviryam, Vada Kapakaram. Virejanam, people give hot water. Only after the bowel movement starts, you should give hot water. Koshtarujam, Gulmam, Narajam, Lavanarasam, Tikta Kadurasam, Vushnaviryam, Kafavadagaram. And lukewarm water is given. Shidam is Tampanam, you know. Next. Sardula means lion. Next. BPH. Chandraprabhavadi, Kokshuradi Gugulu, Shivaguliga. The Shivaguliga available in market is Aksha Pramana, 5 grams. So you should not write 222. You should write 1/4 only. And what is the use of Shivaguliga and Chandraprabha when good Shilajit is not available? Swarnatabi Shilajiti, Tamratabi Shilajiti, does it exist? And we teach. And student by heart also. So 8 types of Haridagi, Vijaya, Hemavadi, Nayantara, all these things they study. What is available? Pinjuk Kadukai, Kabul Kadukai. In the market only 2 things are available. Market pakame poradilliye doctors na. Adivadayam 3 samples are kept. 12,000, 7,000, 3,000. Shopkeeper tells 12,000 and you believe. It is a belief system. So you should bypass belief and bypass faith, and you should have understanding that it is a science. One foreigner came to Vaidyanathan sir and he was going on arguing with sir. I was a small boy standing outside. Standing behind him. And he was telling at one stage, he told, sir, I don't believe in Tridoshas. What we will tell? If you don't believe, you go. Like that we will tell. Sir didn't tell anything, waited, took a deep breath and told, my dear, there is nothing to believe. Only you have to understand. See the word? That's why he is great. There is nothing to believe. Only you have to understand. We need understanding, not by hearting. People by heart. Basic things you should by heart. Now they conduct Ashtanga Gradayam, Satram, Yajnam, Parayanam. Now Parayanam is becoming famous. Parayanam, all these. That is also needed. But limitations we should know. Next. Valuga gold, it looks like Swarnavangam. Kupi Pakvarasayanam, Valuga, Sukumara Legium, Dasamula Haridagi, Avil Toladi Baspam. Avil Tola means Pudi Karanjam. Shilajat Baspam, Abraga Sanduram. Vastiyamayandaka Gradam is Pitta Samanam. Sugumaram is Vada Samanam. Varunadi is Kafavada Samanam. Saptasaram is Kafavada Samanam. Abhyangam with Danvandara Dailam. Danvandara Dailam and Vidaryadi both are having same properties. They are Madhura Rasa, Madhura Vibhaga, Sida Virya, Snigdha Guna, Vada Pitta Samana, Kafavardhana. But Palasrudi of Vidaryadi is above Nabi. Palasrudi of Danvandaram is below Nabi. So both are same. So Sugumara Lekhyam with Misraka Snegam Virejanam, Anuvasanam with Pipalyadi Tailam. Now we will see a case of prostate cancer. Prostate cancer is very common cancer, slow progressing cancer. Symptoms: trouble in urinating, blood in semen, discomfort in pelvic area, bone pain, erectile dysfunction. Obesity, alcohol, fatty diet, painters, tire plant workers. Metastasis, it will go to the bones, lymphatic system. Finasteride and dutasteride reduce risk. There is a score called the Gleason score. The score more than 3 is significant. CT and PET scan. In our hospital, we write PET scan for cancer and Alzheimer's. Only 2 conditions I write PET scan. And prostate cancer, there are 4 stages. There is no specific treatment plan. Treatment depends on avastha, sthaniga dosha, agantuka dosha. There is a vague reference about cancer, which is told in another context. Sharira avayavastu paramanu vedena abarisankhya bhavanti. Adi bahutvad, adi saukshmyad, adi indriyatvad cha. Tesham samyoga vibhage paramanunam karanam vayugu. Karma swabhavasya. Karmam, that is why I tell karma is a slow acting virus which has got a longer incubation period. Next one. Next. Huh? Cancer on the metastasis. In all metastasis, whenever you treat cancer, the multiplication of cells is done by Vayu. Vayur vibhajadi, tejayenam bhajadi, avakledayandi, pradhivi samhandi, agasham vivardayadi, evam vivarditaga sayada astapata jihva grana karna nidambadi birangaihi. So you have to treat Vada by a Vasti. Prasara Gadi is also due to Vada. So this Vada has to be treated more in metastasis. There comes IP admission and Vasti. Mulachedena vrikshavat. That is very important. The clinician should not confine to text alone. Shodhanam is useful, wide range. So you can give Patya Punarnavadi, Varunadi, Ardha Vilvam, Chitraka Grandhyadi, Veeradaradi. Ardha Vilvam. Ardha Vilvam does not contain Vilvam. Vilva means one pala. Ardha Vilvam Kashayam, Kadurasam, Kaduvibhagam, Ushnaviryam, Vada Kafagaram, Shofagnam, Mutralam. Chukku Chundi Kadaladi Kudutua, Adil Ner Pagadi Punarnavam. Shunti, Abamarkam, Duralabam, Punarnavam. It can be given in various diseases. It has got Mutramala Shodhanam property. Chitraka Grandhyadi, very important yoga in amenorrhea also. Very, very good yoga if properly done. All the yogas are like that. Chitraka Grandhyadi, Hinguvajadi, Shardulam, Narajam, Ajajibadadi. Ajajibadadi is a very famous yoga. The last word of Ajajibadadi is the first treatment in renal failure in our hospital. Bonimba Mahaushadascha. Chronic renal failure, diabetic kidney disease, we are going to talk. Nephrotic syndrome, we are going to talk. Hypothyroidism, hyperuricemia. Chandraprabha, Triphala Guggulu, Shivaguliga, Varunadi Gridam, Guggulu Diktakam, Balladaga Gridam, Kafajona, Rogastina, Vivandasti Kashana. San Vastiamyandaga Gridam, Desamula Haridagi, Sugumara Lehium, Kshara Agadam, Avil Tola, the Basmakanji. Basmakanji, so kanji is made, Yavagu. So whenever cancer, many people do not agree. If they do not agree, that is okay. We treat lymphomas with some medicines from Jora and Pandu and Raktapitta. And every chapter it gives a clue. Grandhi, Arbudam, Shukatosham, Lingavarti, Swaragni, Mamsarbudam, Duyarbudam, Alasam, CA, tongue, Mamsa Sankadam, palate CA. References are available. Cancer is Sannipada in nature. We should apply the concept of Dadupaka, Malasanjaya, Karmaja, Kledayukta, Srodo, Dushti, Arishtalakshanas, Indriyasthana, many metastatic features are told. One day I will be talking about current relevance of Indriyasthana in day-to-day clinical practice. Nobody had touched that topic. We will talk about that. One day I am studying on it. Studying, correcting, still confused. So if you take Gulma Chikitsa, every chapter there is a, understand it very carefully. This is a very, very important point, my dear students. Ashtachurnam, Hinguvachadi, Vaishwanaram, Chardulam, Naracham, Habushadi, Dadida Gridam, Lashuna Kshirabhagam, Nilini Gridam, Dandi Haridagi, Balladaga Gridam, Agadaksharam. Ashtachurnam, gas abdomen, Hinguvajadi, non-ulcer dyspepsia, Vaishwanaram, spastic colon, Sardulam, Virajanam in gastric ulcer, Narajam, benign duodenal mass, Habushadi, duodenal ulcer, Dadi the Gridam, chronic duodenal ulcer, Lashuna Gridam, duodenal ulcer recovery with pain syndrome, Lashuna Kshirabhagam, spastic colon with pain, Nilini Gridam, purgative in duodenal ulcer, Dandi Haridagi, small bowel CA, Balladaga Gridam, mass abdomen, Agadaksharam, mass abdomen with metastasis. Why this order? Why they did not start with Balladagam? Gulmam is a Vadakafa Roga. Amurta Vayu is converted into Murta Vayu. Amurtam is Nirguna. Murtam is Saguna. So it is Pradivi Buddha. Akasa Vayu is converted into Pradivi. Kapajona Rogasti. Navibandasti Kashana. Then they would have told Balladagam. They didn't tell Balladagam because starting from Ashtachurnam to Balladagam, they cover the whole GI tract pathology, simple gas, non-ulcer dyspepsia, ulcer dyspepsia, esophagitis, gastric ulcer, small bowel ulcer, small bowel benign mass, small bowel cancerous mass, large bowel CA with metastasis. I can talk about all the yogas in every chapter like this. See this beautiful order. Charaga is not a fool. He starts with Nagabedam, which is Achetana, and takes you to Anavastita Chittatam, cyclothymic borderline personality with bipolar. 27 neurological diseases are told in Nanatmaja Rogas. 81 is told, we call it 80. Like Dasamola, how Gokshara came in Dasamola. Goksharam is a fruit. Ayurveda and cancer management. Now we will see how I treat the cases. There is a case, OP number, discomfort in pelvic area, trouble urinating, decreased urine flow, incontinence. Jaundice 16 years before, people write Ashtasthana Pariksha. Ashtasthana Pariksha. Nadi NAD, Malam NAD, Mutram NAD, Jikhva 4 per minute. I went as an examiner in a college. That fellow is not at all telling anything. I asked, what is Prakriti? Silence. What is Vikriti? What is Doshagati? What is Adogati? Adogati. What is Tiryagati? Then I told, silence is not the absence of sound, but the absence of self. Anandamayima told this. Not Amritanandamayi, Anandamayima, Kashi. She only told human life is a pilgrimage to God realization. What a word. That is why I also told, in my quotes you can see, the fate of Ayurveda is different from fate of Ayurvedic doctors who intend to practice it. The fate of Ayurveda is different from fate of BAMS doctors who intend to practice it. Therapy becomes healing only when the healer is involved. The Chikitsa Purusha, you are the healer. Healing touch, I am me hasto Bhagavan, I am me Bhagavattara. So in this cancer case, there is diverticulum and colovesical fistula operation was there. So before treatment, low hemoglobin, high USR, urea creatinine normal, uric acid slightly high. PSA was 900. See that. PSA was 900, normal is 4. RBC was present, leukocytes, pus cells were present, ultrasound was taken, prostate, mid-gland, left peripheral zone, malignancy, nodule with features suggesting capsular breach, radiological stage T3A, small T2 hyperintense right para-midline prostatic cyst. So transurethral resection with biopsy was intended. CT features denotes prostate malignancy confirmed. Bladder is distended with diffuse wall thickening. PET scan was taken. See the PET and you see the prostatic mass in the lateral side of the right side. Ill-defined hypodense lesion, significant restricted diffusion with PSMA uptake in the posterior medial lateral segment of the left base and mid gland. Comments. Primary prostatic malignancy with no lymphocytal spread. So before treatment, we have evaluated completely. Then only I touched the case. In our hospital, sometimes it takes 7 days, 8 days to diagnose. Just anulomanam will be going on. It has taken 8 days in some cases. Monoclonal gammopathies and all. 8 days patient. Now we diagnose the case. Subclavian artery occlusion. Right hand there is a pulse, left hand no pulse. We did CT angio and it was subclavian artery occlusion. We did angio, there were triple vessel disease. There was a girl came last week with 85 oxygen saturation. Nobody checked that. There was polyarthralgia. They treated like seronegative arthropathy. And oxygen was low and there was a syncope attack. We did Holter. Holter was normal. There is no sixth sinus syndrome, sinus pass or sinus arrest. So then we put her on CT chest. We saw an aneurysm. Aneurysm. There was an aneurysm and oxygen was low. There is no pulmonary hypertension. Then our cardiac surgeon corrected it with a clip. Then oxygen became 95. They cried here. They cried and thanked us. So urinary bladder is distended with wall thickening. Total number of bits for biopsy is 10. Number of bits with carcinoma 10. This is the biopsy report. Treatment. When Raktam is going for Kaya Chikitsa, Adogada Raktapitta comes to the mind. Raktadisaram, Rakta Arshas. But Raktam is told in Urakshadam, Uro Vibhajyade Adyartam, Mutram Shonidam. Enga varadu paru. Urakshadathila varadu. Kushmanda Rasayana. நம்ம கொடுக்கிறது prostate-ல. Uro Vibhajyade Adyartam, Mutram Shonidam. Madhanidana. Susruthila irukku. So treatment of Raktadisara, Rakta Arshas, Pittaja Mutra Krichra, Maduram cannot be started, Tiktam started, Pitta Jara, Shadakshina is usually adopted, Vamanam is avoided. So Brigatyadi Kashayam, Vasa Guduchyadi Kashayam, then Tiktarasam, Madurarasam, Sadavaryadi, Trinapanjamulam, Shira Kashayam, Yervar Bija Churnam, Sadavari Legium, Mahadikta Gradam. Then after that, RBC went away. RBC went away. Leukocytes become normal. Upadravam is handled. Now, Tesham Pradana Prasame Prasamaga. Kafavadagaram in Vadasthanam. Kafavadam. Gulmahara Chikissa. Varunadi Kashayam. Shardula Churnam. Naraja Churnam. Amurdadi Sanjeevi Churnam in Siddha with Kaushe Asma. Nandikal Pasmam. Nandikal. It is given. Chandra Prabhavadi. Shivagudiga, these were given in various avasthas. Then ESR normal, urea normal, uric acid normal, cholesterol was high. PSA became 4.72. Saju, can you project this? This slide? Not possible. Okay. Free PSA is also came down. Gradually PSA came down. Now we took a scan. Known case of CA prostate on treatment. Prostatomegaly. No fluids. Postoidal urine is 12. Small prostatic cystic lesion in the right side with midline anteriorly. Enlarged prostate with 31 cc. No lymphadenopathy. So prostate cancer reversed. Prostate cancer reversed. This happens every day. We don't market it or tell it to anybody. If you go to some hospital, they write names of certain diseases. All the companies, reps are coming with a bag and they tell kidney stone, body pain, periods problem, constipation, migraine. Why can't they tell we have a medicine for demyelinating neuropathy, multiple sclerosis, myasthenia gravis, give this. They don't tell. If you go behind the company, the disaster happened Ayurveda when we started going behind the companies. Companies make money and they become millionaires. Ayurvedic poor doctor, clinician suffers a lot to buy a Maruti car. Pala Ayurveda doctor ku ponne kedaikiradilla. When I was a young boy, I was in love with an Ayurvedic student. I asked, can you marry me? I can't marry you. She told me. Why? She told, two beggars cannot live together. She told. That is the state. Now status has little improved. So this is the thing. Now another scan is taken. That shows no pathology. Common urological diseases. Erectile dysfunction. Erectile dysfunction is an important problem. Erectile dysfunction gives money to many quackery vaidyas. Night after 1 o'clock, sometimes I used to study, I switch on the TV, some Dubakur channels. One Vaidya with the turban is coming and telling so many medicines for ED. Erectile dysfunction. அந்த லேகியம் இந்த லேகியம் ஆனை குட்டி லேகியம் பூனை குட்டி லேகியம் குரங்கு லேகியம் ஒருத்தன் குரங்கு லேகியம் சாப்பிட்டு வாயை திறக்க முடியல ஒட்டின்றது. இந்த லேகியங்கள் எல்லாம் வித்து தங்க பஸ்மம் அந்த பஸ்மம். முன்னாடி காளிமுத்துன்னு ஒரு டாக்டர் இருந்தார் பழைய காலத்துல, நான் சின்னவனா இருக்கும். இந்த செயற்கை உடைந்த சிற்பம் போன்றது. எவ்வளவு பெரிய வாக்கியம் பாரு. ரசனை இல்லா இல்வாழ்க்கை உடைந்த சிற்பம் போன்றது. அந்த மனுஷன் மருந்து வேலை செய்யறதோ இல்லையோ அந்த கற்பனை. ஒரு காய் சிகிச்சா படிச்ச பையன் ரசசாஸ்திரம் பொண்ண லவ் பண்ணினான். அவன் கவிஞன். ஆயுர்வேத டாக்டர் எல்லாம் கவிஞன் தான், நான் கூட கவிஞன் தானே. அவன் இவனை பார்த்து சொல்றான், ரசசாஸ்திரம் பொண்ணை பார்த்து, உன் காந்த விழிகளில் கட்டுண்டு கிடக்கும் லோகமண்டூரம் நான். கவிதை பார்த்தாவ ரசசாஸ்திரம். உன் காந்த விழிகளில், அப்பா காந்தத்தை தொட்டுட்டான், கட்டுண்டு கிடக்கும் வந்தன மூர்ச்சனம் ஜாரணம் லோகமண்டூரம் கூபி பக்க ரசாயனம் ஐ லவ் யூன்ட்ட ஒரே பாயிண்ட்ல அடிச்சுட்டான். இந்த மாதிரி எல்லாம் எழுதி, இந்த மாதிரி எல்லாம் ஆயுர்வேதத்தை பத்தி ஜோக்கெல்லாம் எழுதணும். சும்மா அப்படியே இப்ப சொன்னதையே சொல்லி படிச்சுட்டு ஒருத்தன் ஓரலுக்கு வந்தான். ஒன் ஃபெல்லோ கேம் இன்டு தி ஓரல். ஹி இஸ் a ரஜினி ஃபேன். ஐ ஆஸ்க்ட் ஹிம் வாட் இஸ் ஊர்துவகதி. சொல்றான், மேலே பார் ஊர்துவகதி, கீழே பார் அதோகதி, சுத்தி 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 பார் திரியகதி. மார்க் போடுவீங்களா சார்? நான் என்கிட்ட என்னத்த மார்க் போடுறது? இதே சிவாஜி ஓரலுக்கு வந்தா என்ன சொல்லியிருப்பார்? அப்பா வேலை பாருப்பா, ஊர்துவகதின்னு சொன்னே நீ கவனிக்காம விட்டுட்டே அப்படின்னு சொல்லியிருப்பார். இந்த மாதிரி எல்லாம் மிமிக்ரி எல்லாம் பண்ணணும். ஏன்னா எல்லாம் ஆயுர்வேதத்தை நகைச்சுவையாகவும் கருத்தாழம் மிக்கவாகவும் சொல்ல வேண்டும். தமிழ் கூறம் நல்லுலகம். அதனாலதான் ஐ ரோட் ஆல் தி எக்ஸாமினேஷன் இன் தமிழ். அதுல ரெண்டு ரீசன். when write in Tamil, it's my language, the ideas flow. The second thing, the paper will go to Dr. B. Vaidyanathan because it cannot go to other side, other states. Those who Tamil can only correct. The sir will naturally correct. And sir, sir used to make me cry and insulted. So many things happened. But in the oral final Kaya Chikitsa, he didn't ask anything. He asked me, which course you want to study? I told MD Kaya Chikitsa. Then Anjaneya Murthy sir was there. He asked sir, he asked questions. After question, I answered. Sir was enjoying. Then sir told, Anjaneya Murthy sir told sir Vaidyanathan sir, sir, do you want to ask Mahadevan any question? Do you know what sir told? Asking question Mahadevan is asking question to myself. That's the word he told. Asking question to Mahadevan is asking question to myself. I know what he knows. Then I got 93 marks in Kaya Chikitsa when after the things were over, when we were sitting, Mahadevan, 93 is a very high mark. I should not have given. But I know the transmission of knowledge. I gave you 92 or 93 in 2 papers. It is not correct for a medical thing. But I am sad. I asked you, why are you sad? I am not allowed to give you centum. I told sir, I don't deserve to get centum. Nobody can get centum in Kaya. Still we make error. Percentage of error, hypersensitivity, bad prognosis is common to all the practice. So man with heart disease, they take Viagra and they get heart attack, gone. Coach, first night anige idarudungaran illaya. எல்லாம் டிஎம்டி எடுத்துட்டு தான் ஜாதகம் ஓட டிஎம்டி வித் blood group with prakriti analysis. Vada prakriti marries a kapha prakriti. Vada will get up by 2 o'clock. Kapha will be at 8 o'clock. He will get appetite by 4 o'clock. Upma will not be ready. Pongal will not be ready. Vadai will not be ready. Quarrel diverts. பிரகிருதி பார்க்கணும் இல்லையா? பிரகிருதி எப்படி பார்க்கறது? அவன் அப்படியே அப்சர்வ் பண்ணி பார்க்கலாம். one fellow goes to the shop and take a white colored t-shirt. He is kapha. Green colored shirt, he is pitta. If somebody takes an underwear with Jackie Chan and Bruce Lee, he is vada. Why do you want Jackie Chan there? He is a fighter. If he hits, that's all. Abhighadam. So atherosclerosis, penile atherosclerosis, penile Doppler, you have to give injection and high blood pressure. Obesity. Obesity has problem always. Parkinson, multiple sclerosis, antidepressants, all the antidepressants make you impotent. Ayurvedic doctors, those who study in colleges, they learn, they don't see much cases, so they do monotone. Pandu undayirunno pressure പണ്ട് പ്രഷർ ഉണ്ടായിരുന്നോ? ഇല്ല. വിശപ്പ് പണ്ട് എങ്ങനെ വിശപ്പ്? കല്യാണം കഴിഞ്ഞ് 4 കൊല്ലമായി, കുട്ടികളായില്ല. അതിനു മുമ്പ് കല്യാണം കഴിഞ്ഞില്ലല്ലോ. ദിസ് ഈസ് ഹൗ ദേ ടേക്ക് ദ ഹിസ്റ്ററി. മോണോട്ടോണസ് ഹിസ്റ്ററി ടേക്കിംഗ്. History of presenting complaints. Long ago, so long ago, when this boy was crossing MG Road in Trivandrum the college, moving towards Asok Bhavan to take a Rasavada and Nairos as a Vicharana, as a Snagavanam, and he was hit by a red-colored bus and he went away. One part of the leg became twisted. History of presenting complaints. இப்படிதான் எழுதுறான். ஒருத்தன் கேட்டானா ஒரு பரீட்சையில, பசுமாட்டை பத்தி கேட்டிருக்கான். பசு. இவன் தென்னை மரத்தை பத்தி படிச்சிருக்கான். தென்னை மரம் வழித்தான். தென்னை மரம் ஒசரமா இருக்கும், தேங்காய் வரும், இளநீ இருக்கும், இளநிய குடிக்கலாம், இளநீ தேங்காய் சட்னி வைக்கலாம், வறுத்தரைச்ச குழம்பு வைக்கலாம், எல்லாம் எழுதிட்டான். என்ன கேட்டிருக்கான்? பசு. கடைசி எழுதினான், இப்படிப்பட்ட தென்னை மரத்தில் பசுமாட்டை கட்டலாம். பசுவை கொண்டு வந்துட்டாருங்க. அதே மாதிரி என் கூட ஒரு பையன், ஒன் ஃபெல்லோ ஸ்டடிட் வித் மீ இன் 3rd standard. மழை எவ்வாறு பெய்கிறது? ஹவு ரெயின் இஸ் கமிங்? தட்ஸ் a question. மழை பக்கத்துல நான் பார்த்துட்டு இருக்கேன். he was getting paper after paper from the examiner. மழை சோ 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 என்று பெய்கிறது. Sometimes I talk in Tamil, you adjust, I will talk in English also. Cocaine, marijuana, methadone, nicotine, opiates, Peyronie's disease, the penis will be bent, still you can have intercourse, sleep disorders, depression, stress. Because of the stress and current day lifestyle, erectile dysfunction is becoming an epidemic. Snoring has produced divers. என்ன கொரட்டை விடுறான்பா எங்க ஹஸ்பண்ட். சார் ஏதாவது மருந்து கொடுங்க சார். when I was going in 2nd AC from here to Chennai, when mommy and mama started snoring, they went to Uchasthai, Raga Alavana, Pallavi, Ettigala Chavukam, Tisra Misra Gadi எல்லாம் பாடி நான் சஜுட்ட சொன்னேன், சஜு துரோண புஷ்பி இருந்தா நல்ல கோமூத்திரம் சேர்த்து மூக்குல ஒரு சுரச நசியம் பண்ணு, ஏதாவது ஒண்ணு நடக்கும். ஒண்ணுல நிற்கும், இல்லைன்னா கொரட்டை நிற்கும். அந்த அளவுக்கு டேஞ்சரஸ் ஸ்னோரிங். இதெல்லாம் கல்யாணி, காம்போதி எல்லாம் வருது. This Kamboji came from Cambodia, so it is called Kamboji. Cambodia, Kandahar, Skandari is Kandari Milagi, Malaga, Kandari Malagai, good for triglycerides. எல்லாம் அங்கிருந்து வந்தது. பாரத வருஷே பரதக்கண்டே மேரோகோ தட்சிணே பார்த்தே சகாப்தே அஸ்வின் வர்த்தமானே வியாபகாரிகே, அங்க வரைக்கும் அகண்ட பாரதம். Bhavamna kafam, ragamna pittam, talamna vayu. Bhava raga talam. Adan vada pitta kafam. The deshathukke tridosha deshamnu per. Everything is tridosha. There is everything. There is nothing separate. Vidya and avidya, atma and anatma. You should know what is anatma. We have a Vedantist. Erectile dysfunction is told in rasam and Calibium. Infertility is told in Shukram. Shukra Dushti is told in Sharirasthanam. Infertility treatment is told in Sharirasthanam. Akara Karabadi Churnam, Ashwagandha Churnam, Kabigachu Churnam, Dadagalpa Churnam, Salab Misri, Nagabala Rasayanam, Narasimha Rasayanam. Narasimha Rasayanam produce sexual energy for men. And it produces hair. What does it mean? Anybody answer this question? It is a testosterone increasing medicine. Male sexual vigor with hair growth. Testosterone. Travel. Narasimha Rasayanam should be taken with Bringaraja. Shaju is laughing and he is leaving the place. Narasimha Thailam is available by Sitaram Company. Saraswadarishtam. Saraswadarishtam is the only arishtam which can be given with buttermilk. So the question comes, Samyoga Viriddham. Then they say Chakramani, Gulma Chikissa, Charaga, Lashuna Kshiravagam. So Viriddham is applicable to Ahara. Saraswadarishtam contains gold. I don't know whether it can be made in gold pot and all. Saraswati is Brahmi. Brahma's wife is Brahmi. When Brahma's wife Brahmi is reduced inside the body, we supply Brahma's wife Brahmi from outside. Brahma, Brahmi. Male. Brahmi is Saraswati. Saraswati is Buddhi. Meda Dakshinamurti. Kallalin Pudayamarand Nan Marai Arangam Katra Kelvi Vallargal Nalvarakku Marakirenda Puranamai Marakappala Yellama Yelladama Irindadana Irindabadi Kati Cholamal Chunavare Ninayaman Ninaindu Bhavattodakai Velvam. Guru, superior Guru is Meda Dakshinamurti. And he is teaching his silence. Enna concept? Enna? Vadai has come. Correct. Adu vandidrathu. Vasanta Kusumagaram, Sitta Magara Dwajam. Magara Dwajam means the reproductory organ of crocodile. Dwajam, Makaram. Mayana Dailam. Shukra Vardhana Vasti, Habushadi Vasti. Walking. Then cystitis, bladder infection, E. coli, inflammatory cystitis, bacterial cystitis, drug-induced cystitis, cyclophosphamide-induced cystitis, radiation cystitis, catheterization cystitis, chemical cystitis, diabetic cystitis, renal vesicular stone cystitis. Pregnancy cystitis is common. Catheter usage cystitis. Kidney infection cystitis. Mutra krichra chikissa, jora chikissa, siktarasa, sida virya, mutra laushadas. Amrudadi kashayam, kogilaksham, trinapanjamulam, brigatyadi, veeradaradi, sukumaram. Chandra prabhavadi, sandanadi vadi, sudarsana vadi, karpura shilajat. Brigatyadi gradam, trikandaka gradam. There are two gradas. Two gradas in Pramegam. Dhanvantaram Vada Kafam. Trigandagam Vada Pittam. Trigandagam Misranam Sannibada. Asavam. Sarivadi Asavam, Chandanasavam, Ushirasavam, Sudarsanasavam, Abraga Basmam, Akika Basmam, Pravala Pishti, Badarashma, Nandikal Paspam, Kallar Basmam, Sweda Barpadi, Akikam, Akika Basmam, Duda Babeshwar is making. Badarasma, Rasaushadi, Sweta Parpadi, overactive bladder. Urge to urinate 7 times. Normally you urinate. They urinate more. Yesterday we have a diabetic insipidus. 60 times she urinates. We diagnosed it. I have seen only 4 cases in my 24 years of practice. 2 diagnosed cases, 2 cases I diagnosed. We gave the Udagamegam Kashayam of Susruda, separate yoga, it was not effective. Adipravrti, Janya Mutra Vigara, like that we treated, we were referred to endocrinologist. UTI, very common. UTI in women is common. UTI in men needs investigations. Kegel exercise, very important for bladder incontinence. Incontinence, Chala Vriddhi, Stirakshayam, Stambana Chikissa, Danvandaram Kashayam, Sugumaram Kashayam, Stira Kshira Kashayam, Sugumaram Kshira Kashayam, Vorudal Tamarai, Ratna Purush should be given. Kshirabala 101, Vasti Amaya Antaka Gradam, Abraka Sanduram. It took 7 years for Vaidyanathan sir to complete 100 pudas of Abraka. He told me. He told me one day. Balalakshadi Tailam, Pishu with Danvandara Tailam, in various types of incontinence, atonic bladder, Chiruvulvadi, overactive Sugumaram. Here, Vada Kafakara Chikitsa, atonic Gulma Chikitsa, overactive Kevala Vada Chikitsa, Chala Vriddhi Hara Chikitsa. Bladder cancer is an important area. Do you have a case study? Where it is? This one? Yeah, we'll talk about theory later. 65-year-old female, burning micturition, occasional bleeding while micturition, difficulty in urination, burning sensation, after defecating, increased micturition, hesitancy, bedwetting, Chaya Mutram. We are going to talk. Chaya Mutram of Kashyapa. Somarogam, diabetes insipidus, Kori. We are going to talk. Many people call leukorrhea. It's not leukorrhea. Past history. Diabetic 20 years, hypertensive, hypothyroidism, hemoglobin 8, ESR 80, CRP positive, urea high, creatinine high, diabetic kidney disease stage 1 with erythropoietin deficiency, anemia with elevated ESR, which is an inflammatory marker. Glucose 2 plus, nitrate positive, leukocytes positive, RBC 3 plus. By bladder growth with cystitis, needs CT. USG, bladder growth with cystitis. CT, enhancing lobulated intravesical soft tissue lesion arising from trigone and posterior wall of the bladder, meatus normal. It's a case of regional cancer center. See the reports of regional cancer center. There is ulcerative lesion in the posterior fornix, carcinoma of bladder, recurrent endometrium, review with CT scan endoscopy. Repeat. No hematuria, all these things, regional cancer center report, Cancer Institute, Adayar, seen by an oncologist. So, Adogada Raktabita Chikisa I started. Gatyadi, Trinavanjamulam, Sadavari, Tiktam, Maduram, Sadavari Gradam, Tiktarasam, Madurasam, Pittasamanam, Shida Vidyam, Kafam wrongly written, correct it. Renal calculi, UTI, dysuria, hematuria. After that, the RBC and all went away. Second phase, Apanavata, Sthana, Kafa Vriddhi, Varunadi Kashayam, Gugulidikta Gradam, Shivaguliga, Dasamula Garidagi, Tamra Katte Sanduram of Siddha. So urea creatinine came down. After treatment and treatment, you see this. Known case of CA bladder, can you enlarge? No. Known case of CA bladder, you see the bladder, there is no growth. No bladder growth and cystitis. See, Dr. L Mahadevan, our hospital name is there. Post hysterectomy status, 8 months treatment, no chemotherapy. They were afraid of chemotherapy. Bladder cancer, reversed. Transitional cell carcinoma, reversed. Cancer, that's why I am going to talk about oncology. All the students, those who are interested, can register the free 6 months course on clinical medicine. I tell you, if you hear me and sit with me in my OPD for 3 months, I can convert clay into gold. It's not ahangaram. You have tried so many things. Why can't you try this? This is what my guru has given me. Clinical medicine is enjoyable. Many people do not examine the patient in the bed. They don't examine. So you should write to me. My number 9443362982. No phone calls. You can see, write what do you feel about these classes and what do you want me to talk to improve your skill in the future. So I will be talking it on one day. So no cancer, hematuria, painful hematuria, painless hematuria. Painful hematuria, you are safe, patient is safe. Renal stone infection, painless hematuria, cancer, tuberculosis. Painful gross hematuria, microscopic hematuria. Same treatment, same type of treatment. Already I told you. Hereditary hemorrhagic telangiectasias, painless hematuria, IgA nephropathy. Kuduchyadi, Tiktakam, Mahatiktakam, Bragatyadi, Vasa Kuduchyadi, Kogilaksham, Trinapanjamulam, Sadavari, Kshirakashayam, Sudarsanavadi, Laksha Churnam, Pushyanagam, Chidakashayam, Yervar Bijam, Sadavari Gradam, Kushmanda Gradam, Puro, Vivaji, Ashtadasha Kushmanda Gradam, Pittaja Unmadam, Adu Vere, Adi Estimate Kalkam, Adu Vere, the Pittaja Unmadam, Mania Gulad, Pastiamayanda Gradam, Lehiam, Sadavari, Kushmanda, Masavam. Prostatitis. So, எவ்வளவு நேரம் பேசியிருக்கோம்? 1 hour. Prostatitis may or may not be due to bacterial infection. There will be E. coli is very common. Klebsiella is also common. Pain, when the blood comes first, the lesion is below bladder, mixed with the bladder. Blood comes in the end, the lesion is in the kidney. So, prostatitis, pain after urination, nagging pain, low-grade fever, pain in the anal tip. All. So, it is pitta vritti in Abanasthana. So, Guduchyadi, Pachanamradam, Sadavaryadi, Mahatiktakradam, Samanasnegavanam, Trivrithilegiam, Virejanam, Brigatyadi, Sadavari Gana, Kshiravasti, Avagagasvedam in cold water, Pichu with Narayana Delam, Narayani is Sadavari. Vadasini is also mainly Sadavari. This is how the prostatitis is treated. Acute prostatitis, chronic bacterial prostatitis, chronic non-bacterial prostatitis, chronic non-bacterial relapsing prostatitis, prostatodynia, chronic pelvic pain syndrome, reflux sympathetic dystrophy, common regional pain syndrome. So many subsets are there, which I will talk tomorrow. Thank you very much. Thank you very much for patient hearing. Over to Hema.
Thank you, sir. That was a very wonderful session about the prostate cancer, and we have also seen the case studies, which looks really scientific. And over to the participants. So there is a raise hand option where you can ask your questions by raising your hand directly to sir. Sir, can you explain about microalbuminuria and its management, sir?
We have to teach diabetic kidney disease, hypertensive kidney disease, microalbuminuria, polycystic kidney disease, horseshoe-shaped kidney, ectopic kidney, nephrotic syndrome, nephritic syndrome, diet in kidney disease, potassium problem, sodium problem, chloride problem, bicarbonate problem. Another 3-4 classes are there.
Okay, sir. Okay, sir.
You have only covered 40%. I ask Ayurveda authorities should arrange other classes.
Sure, sir. We will also arrange, definitely, sir.
Yeah.
Sir, and in some patients with urinary calculi, sir, some patients they don't show symptoms, but when we take the scan, as they show the calculi is there. So
if there is obstruction, there will be symptom. If there is no obstruction, there is no symptom.
okay, sir. Okay, sir. But still, the kidney function test, everything will be normal, sir.
It will be normal. It will not affect.
Okay, sir. Okay, sir.
It will be normal.
Okay, sir. Sir, and I have treated a case of erectile dysfunction earlier in my practice. So in the beginning, when the patient came, when I gave the medicines, I don't remember the medicines that I need to refer, and I'll definitely ask you in the WhatsApp number, sir. But the doubt is, I gave some medicines, sir, but what happened was the patient showed some improvement. But after a certain period of time, maybe after 5 months or 6 months, drastically all his improvement came to a standstill again. So what would be the reason specifically, sir? Because I was giving him some lifestyle changes. I was giving him all the diet pattern and everything. But all of a sudden, the patient reversed back. So what would be the reason, sir, specifically?
Mostly looks like stress. Stress will affect sexual activity, diabetes, lack of exercise, not liking the partner, some emotional disturbance, post-viral sequel would have happened.
Okay, sir.
Stress is very common. Many times these sexual medicines marketed by companies, the outer cover of the medicine gives better results than the inner ingredient.
Okay,
they put
sir.
all these photos.
Okay, sir.
Internally, all these Kabigachu, Ashwagandha, same thing will be there.
Sir, trace amount of protein in urine with ASO titer above 300. Is there any relation?
Yeah, in pyelonephritis, post-streptococcal nephritis, ASO can be increased up to 333 totes unit. It can be normal. Isolated ASA, there is no need to treat. Okay, when ASO is associated with increased ESR, increased CRP, fever, throat pain, mid-systolic click, mitral involvement, and pulse rate more than 120 with fever, which is rheumatic, the cases are very less. ASO titer is true positive. Whenever ASO titer is positive, there is no need to take penicillin. Okay. ASO is losing importance. Proteinuria can be reversed. Probably with simple Pachanamradam, Guduchiyadi Kashayam, it will go away.
Okay, sir. Sir, PSA management, please. One doctor is asked about PSA management.
That is what I have been talking. PSA up to 4 is normal. In prostatitis up to 12 is normal. In cancer, it will go up to 1000. How we have to treat cancer, I have elaborately talked. Okay, once you treat that, PSA will come down. It's a marker. Okay, sir.
Sir, what would be this is for all the practitioners, sir. Like most of the cases with prostate benign hyperplasia, sir, is there any screening which could help them, or we can just tell like mammogram we usually prescribe for the females after 35 years nowadays. So, so is that good that we can ask them to go for a screening? If it is yes, then at what age can we start, sir?
Above 50 PSA, above 45 colonoscopy.
Okay, sir.
Perirectal examination is cheap and best.
Okay, sir. How to manage recurrent calculi formation in sarcoidosis? Limitations in managing hydronephrosis with obstruction.
Mutragata hydronephrosis, that is Sangam plus Vimarga Gamanam, Varunadi, Ardavilvam, Avil Toladi Basvam, Kalyanagaksharam, Andarduma Pudam, Swarnavangam, Uttaravasti. Gomutra, Chatvaris Taila Gomutravasti is the treatment protocol for hydronephrosis. Sarcoidosis, mostly it is self-limiting. Sarcoidosis of the eye, skin, very rarely diagnosed. Sarcoidosis of the lung in non-responding dyspnea, rule out bronchitis, bronchiectasis, pneumonia, pleurisy, COPD, emphysema. Then you should write angiotensin converting enzyme, ACE, which is around 2,500 rupees. Then if it is sarcoidosis of the lung, you have to treat Madhurarasa Pradhanya Aushadha, Vidaryadi, Nayavayam, Balajiragadi, Kushmandam, Savanapasam, Sarpirkudam, Lakshadi Thailam. Like that, you have to approach sarcoidosis. Once this pathology is corrected, automatically the stone due to sarcoidosis will go away. If you independently want to treat sarcoidosis stone, do Vadashmari Chikitsa. Veeradaradi. Start with Veeradaradi.
From which part of the kidneys calculi can be expelled with medicines?
Anywhere if it is less than 7 millimeter.
Okay, sir. In acute renal failure in diabetes, I had read giving Gritham is good. So if a person has high cholesterol, what would be the line of treatment?
Vata Pittotare Kafe Mande. That is the indication for ghee. Cholesterol has nothing to do with. If Rukshada is predominant, it gives Neva. Mutra Krichram comes under Uttama Matra Snegavana, Aru Balam, 300 ml.
How to approach IG? How to approach in
IG nephropathy, I am going to talk.
Okay, sir.
Albert syndrome and IG nephropathy. We are yet to enter into that. That and all come in the end. Polycystic kidney, Albert syndrome, IG nephropathy, renal artery occlusion, renal artery thrombosis, renal artery, all this comes in the end. Another 4 or 5 classes needed.
Okay, sir. So what oil should be used for BPH when doing Uttaravasti, sir?
Dhanvantaram, Narayana Thailam, Kshirabala, Indriyanam Prasadanam. Dhanvantaram is safe.
Is there any connection in liver and kidney disease?
Hepatorenal syndrome in end stage of cirrhosis, uremia will increase, creatinine will increase, hepatorenal syndrome will come, ammonia will increase, which will produce hepatic encephalopathy. Hepatorenal syndrome is a very big topic in cirrhosis, end stage liver failure. And albumin will be low. Albumin will be low in renal disease. Albumin will be low in liver disease. Anemia will be there in liver disease. Anemia will be there in erythropoietin deficiency due to kidney disease.
There is a patient which was diagnosed earlier with a hyatidite cyst of liver, and before OT day in investigation, he diagnosed as CKD with creatinine level 14 milligram per deciliter. Bilateral CMD impaired without any renal symptom.
Needs a transplant.
Okay, sir.
14 creatinine means Ayurveda will not work. It may reduce, but will not cure. Urea up to 80, creatinine up to 4.5, we can manage. Above that, difficult.
Okay, sir.
We should teach diet to our doctors.
Yes,
their
sir,
patya in renal disease is miserable.
Okay, sir. I think the questions are over, sir, and definitely someone is asking, like, when will your pulmonology book be ready, sir?
Pulmonology already I have commented. Commentary is over. Saju is overloaded and some 100 hours of classes he has to type. You imagine. Now I am writing symptomatology in Ayurveda. A to Z. Signs and symptoms in Ayurveda. A means abdominal pain, like that. B means borborygmi, bloating, like that. C means constipation, cough, like that. D means like this. So up to H I have commented. Up to H itself, it comes around 400 pages. I am writing. I am helped by Jaya, Fatima Shamina, Aishwarya of Chennai. Aishwarya it is doing that work. We are planning to release it when, Saju? Within 3 months, Saju says we will release. That will be my 74th book.
Okay, sir.
You should encourage, buy these books and help us.
Sure, sir. Reason for bedwetting in middle-aged person.
Fear, anxiety, insecurity, or S1 injury. S1, S2 parasympathetic pathway damage,
Okay.
or untreated spina bifida, occulta, or hidden meningeocele.
Sir, for getting your books, I think they can send a WhatsApp message, no, sir?
WhatsApp message they can send, they can ask questions,
Okay, sir.
they should tell about the feedback of the class. I don't know what is happening, what to teach. They should tell, sir, I need this. I need avarana. I need male infertility. Male infertility is a part of andrology which comes under urology. But in I ask Ayush, I want to talk about infertility elaborately, 7 classes.
Okay, sir. Sir, is there any like protocol or any suggestion by you for the new practicing doctors, sir?
Repeat, please.
Sir,
It was,
any guidelines from you for the newly practicing Ayurveda doctors, sir? The doctors who are just about to practice.
see, I am 52 years old. Since 1987, 86, September 26th, I joined Ayurveda. 97, 24th, I started Ayurvedic practice after finishing MD. Recently, I completed PhD. Since 22 years, morning 2 hours, I was studying Ayurveda. Afternoon 2:30 to 3:30 Siddha. Then night 9 to 12 I was reading Harrison. Now almost Ayurvedam reading is minimized. I am addicted. I am addicted like Kanja to this neurology. So always I keep Adams. There are days when I have studied 18 hours. Hard work cannot be substituted by any other thing. Sometimes I feel quacks are better than me. So I study because I want to teach and I enjoy studying. Never study for exams. Morning 1 hour you study, evening 1 hour you study. So every day you study. Don't turn right, don't turn left, don't look back. All the way travel by study and practice to Tridoshik realization. That is what I want to tell. And another thing, there are days when I have not seen my child and I have not touched my wife. But there are no days where I have never not touched Charaga, Harrison, or Boger. Charaga little touching, Harrison always touching.
That's a very good guideline given by you, sir, because most of the practitioners, we don't study, sir. That's the truth. And
As you are very busy with other work. I don't
no,
have any
sir.
other work.
Sir, not like that, sir. We don't take time to study, sir. That is what, as you say, no, sir. We need to go straight away on the Tridoshik theory. So those things we compromise on certain things. So that we have to make a point that we need to enrich our knowledge so that we can serve the people better and be a very straightforward Ayurveda doctor, not going beyond the companies as you told already.
Even I am victimized by this company and there is a pain in the heart. Gandha Dailam is 8 rupees, Maharasnadi is 200. there is pain. Vaishya Kalpanam we should teach 2-3 years so that everybody should make at least little medicine. I asked the student, if you want to make 200 ml of Pindadela, write the calculation. They don't know. They write Samanya Vidhi.
So,
Everything has changed, and practitioners with the theory are not invited for boards. Politics and advertisement, false hope, telling lies. Throughout my life, I have never got maximum MRI in the district written by me. We write around 10 to 12 MRIs per day. Our MRI charge is 2,500 rupees. Till date, I have never touched commission. I have never got a gift from a company, and I have never told exaggerated a clinical prognosis to a patient. I train all my students like that. You should be a good person, then you will be a good doctor. My neurology guru, Dr. Shaktivel, who taught me neurology, used to tell Mahadevan, Dharmatin mel nindru kondu karmathai chei. Stand over the dharma and do your karma. And the dharmam, aram, அதான் வள்ளுவர் சொன்னார், அறத்தான் வருவதே இன்பம், மற்றெல்லாம் புறத்த புகழும் இல்லை. சுகம் எதுல கிடைக்கும்? தர்மத்துல தான், அறத்துல தான் கிடைக்கும். அறம் மற்றெல்லாம் புறத்த த்ரோயவே. நேம் அட்வர்டைஸ்மெண்ட்ல பேர் கிடைக்கிறதா? நிலைக்காது. மற்றெல்லாம் புறத்த புகழும் இல்லை. அது கிரெடிபிலிட்டியே கிடையாது. வள்ளுவர் எவ்வளவு பெரிய மகாத்மா. தமிழ்ல நான் லிட்ரேச்சர்ல ரொம்ப இன்ட்ரெஸ்ட். எனக்கு தேவாரம், திருவாசகம், 11 கீழ்கணக்கு நூல்கள், சிறுபஞ்ச மூலம், ஏலாதி, அதெல்லாம் எனக்கு ரொம்ப பிடிக்கும். மியூசிக்ல பெரிய கிறுக்கு. யாராவது நாசரம் வாசி அப்படியே பாதி பிபி எடுக்கிறத விட்டுட்டு அப்படியே போயிடுவேன். இது எல்லாமே when Vaidyanathan sir was there, he used to tell Mahadevan, this is Murari, this is Mukari, this is Bhairavi. Bhairavi is Ruksham Vada Vardhanam. Others could not understand, but I understood. So this is how you should enjoy, find Tridoshas in everything. There was only final word is study every day, irrespective of your age. Another thing, many doctors do not know side effects produced by modern medicine. Calcium channel blockers produce pedal edema. This fellow will be treating SOFA. If you change it into AC inhibitor by a nephrologist, the edema will go away.
Sir, only one question can I ask, sir?
Please.
The CKD end of stage with BPH, diagnosed for 6 months, creatinine 5.70. There is no symptoms currently. Treatment on Chandraprabha Vati, Gokshuradi Gugulu, Medo Pachak, Rakta Pachak, and modern medicine. What can we do in this treatment?
I need more details about this case. The person can message me 9443362982. I can help him. Gugulu
Okay.
should be avoided here. It is heavy. Guru yoga.
Okay, sir.
You should be lagu.
Okay, sir. Sir, really, it's very difficult to cover Prajnaparada of our own Vaidya family. How can we focus and avoid distraction? Anything special advice?
You need a spiritual guru. I have Yogananda, Jnanananda, Madapuram, Dakshinamurti Swamigal of Thiruvarur. They are with me all the time. Ishvara Arpana Buddhi and Ishvara Prasada Buddhi should be there. Whatever you do Arpana to Bhagavan. Whatever you receive as a Prasada to Bhagavan. Prajnaparadam, even I have done everything, all the mistakes I have done. I am not a jnani or a good person. All the bad habits. And my Parama Guru corrected me, and it was spontaneous. Do you know that? I was worst student in my school days. Everybody used to tell Mahadevan will fail except in Tamil. See what happened. Until I met Vaidyanathan sir, I was a useless fellow, and I even went to him with a feeling that he doesn't know anything. Then he asked him, why are you roaming like this? I told, nobody teaching well. Can I teach you? He asked. I will say, I try. Then at the end, he asked me, if I give my unconditional love to you, will you give back to me? Tamil la kettaara. And then I told, I surrender myself to you, sir. Then he asked the first question. Everybody should know. Ushnena yuktaha rukshadyaha kurvendi vadena sanchayam. Ushnam is opposite to Vayu. Chayam is prakopa. How Ushnam become the nidana for prakopa? என்னுடைய அகங்காரம்லாம் சோர்ல போய் பட்டு செதறி அடிச்சு உடஞ்சுது. எனக்கு தெரியல சார்னு முதல்ல சொன்னேன். ஸ்பான்டேனியஸா வந்துருது அந்த குண சித்தாந்தா. நான் ஒன்னும் படிக்கல, வந்தது உனக்கு கிடைக்கின்றான்னா கிடைச்சிருத்தா. அதே மாதிரிதான் எங்க ஸ்டூடெண்ட்ஸுக்கு எவ்ரிடே தீஸ் திங்ஸ் ஹேப்பன் இன் அவர் வைத்தியசாலை. Spontaneous awakening of the Tridoshic wisdom happen to all these 15 students sitting around me eating vadai.
Yeah, so lucky enough, sir, to be with you and learn Ayurveda with you, sir.
I have great respect and admiration for you. I enjoy your association because your presentation and people like this combination very much. You are like my daughter, and you are my daughter too. And it should be like that. And I like it. That's why I asked specifically, I need Dr. Hema to host the show.
Thank you, sir. Thank you so much for the wonderful session today, sir. And we will get the feedbacks from the participants, sir, regarding the sessions. And we'll send those feedback forms to you, sir. So you can also have a look like how are the participants, what are they expecting, and so on, sir.
They can also write to me what they want.
Okay, sir.
Okay, thank you. Thank you very much.
Thank you, sir. Thank you for the insightful session. Over to Roshni. Dr. Roshni, can you just do the conclusion?
Good evening, sir. Good evening, ma'am. I hope the session was an eye-opening session that made us crystal clear on understanding concepts and skills. Thank you for the session and being one of the member of the team I Ask Ayush, sir. I'm sure we will meet you once again with another topic in this platform, sir. Thank you, sir. People who are interested to participate with Dr. L Mahadevan, sir, can register their number and can have recorded classes of September 30, October 14th, and October 15th. I Ask Ayush. With a successful journey of 3 years, we conduct seminars on various topics on every Saturdays and Sundays with a series of Siksha learning series in English and Anevarukkum Arogyam in Tamil. We also conduct seminars on simplicity of Sanskrit, elaboration of Samhitas, and clinical experience of big shot Ayurvedic physicians and etc. Our videos are telecasted in Facebook Live and YouTube Live. You can also see our past videos in YouTube and Facebook. Thank you, sir. Thank you, ma'am.
Thank you. Thank you, Dr. Shivashankari.
Thank you.
Thank you, sir.
Thank you.